Hi, everybody. It's Kathy from Kickstart Physical Therapy. I'm here with Dr. Burkholder
Hello.
from Olympic Concierge Medicine in Tampa. Right now we're in your office in Land O'Lakes.
Lutz.
Lutz,
Yep.
okay, yes, right, sort of on the border there. They
Yeah.
have a debate on that one. But yes, so welcome and thank you for meeting with me.
Yeah, thanks for coming.
Yeah, no problem. I wanted to kind of highlight what you do, a little bit about who you are, some experience,
Sure.
maybe about why you chose Olympic in the name for your company. So if you can just say a little bit about that.
Sure.
Yeah.
So I'm from Philadelphia.
Okay.
I went to med school up there, college, med school. I played collegiate sports in Philadelphia. And then I found the nice weather down in Florida and a great residency program, Mount Sinai Medical Center. I trained in emergency medicine down in Miami Beach. We were the only hospital on Miami Beach. I also trained at University of Miami and Jackson Memorial. I think it's second largest hospital in the country. And, in the process of working there at University of Miami and Mount Sinai, I came in touch with a trauma surgeon. We were in the operating room, and he had an accent, a Brazilian accent. And I had worked in Brazil for a large healthcare company before medical school, and I kind of picked up on the accent. I said, "Oh, you're from Brazil, aren't you?" He said, "Yeah, and I'm going down this summer." So I said, "Oh, for what?" He said, "I'm the medical director for the Olympics."
Wow.
This is in 2016. And I said, "Oh, do you need an ER doctor?" And he said, "Yeah, sure, call my secretary." And sure enough, 3 months later, I was in at the opening ceremonies, and we were in charge of, really the whole stadium, right? We were the medical crew for the whole stadium at the opening ceremonies.
That's pretty awesome.
And from there, courtside with the Olympic athletes. So that's why we called our practice Olympic Concierge Medicine.
Very nice.
Yeah.
That's very good.
Yeah.
My father would be proud too, because he's Greek and everything to him is like, the Olympics in Greek. And
there you go.
So
Yeah.
It's almost like the movie.
Right.
So that's great. So what started you in the concierge part of your practice?
Sure. So I was a high school and collegiate athlete, and had no pain during that time. And as an early attending in Fort Myers, after I'd left residency and joined a partnership, became a partner, I started to have hip pain. And I did, had an MRI. I was diagnosed with kind of like a meniscal tear in my hips, as well as some mild hip dysplasia. And I had to have 2 hip surgeries to kind of fix my meniscus in my hip, if you will. And I was intubating COVID patients on crutches. And I just said, wow, this is very difficult to practice in the ER right after 2 hip surgeries, 6 months apart. And, so my orthopedist really kind of pushed me to take a desk job. And so I pushed back at him for several years, and I said, no, this is what I've, trained to do. And I've worked my whole life to get into a great partnership in the ER. And we got hit by the Hurricane Ian. And I was in the ER for 7 days straight. And at that point, my hips were just killing me, and decided to leave the great group I was in. I said, okay, well, what can I do seated, right, where I'm not running around to code blues and to traumas and to heart attack patients in the ER? So I figured concierge medicine.
Yeah.
And it's nice because I can kind of work at my own pace. I'm able to provide a service where people don't have to wait on the phone for 30 minutes to schedule an appointment. They don't have to wait a month to get into their doctor. They can come into me, same or next day. And it's pretty cool. I imagine the same with your practice, right?
Yeah.
Working for yourself.
Absolutely. Yep. I think it improves access. So for me, that's big. I can get people in really fast. And I love the fact that we can, I know that I talked to you a little bit about this before, that you can see people one-on-one and take your time with them and really see the whole person.
Yeah.
So to me, that's really important as well. Yeah.
That's the key. My dad is a retired family doctor. and his patients loved him, but he only had 15 to 20 minutes with his patients.
Right.
And that's very tough to get through someone's
Yes.
whole medical history and all their current issues and all their meds. So, we're basically more connected with patients, and no fault of my father or any of his colleagues and any of the other docs out there who are in the big systems.
Sure.
They're just weighed down by the volume of patients.
Exactly.
Right. And the same thing if you were to go and work for a big physical therapy company, you're going to be running through patients as quickly as possible.
Yes.
Because the company is skimming profit off of your work. But when you're able to work for yourself, you can have more time with people, and smaller panel, higher quality, and it really works well.
True. So quality over volume.
Yeah.
And
Yeah.
that's a big value too, because really, what are people looking for? So I think people really they understand that, and people are looking for that nowadays.
Yep.
Because I think that we're sort of a gem in a big system that is just, it's like there's a big split between our fields in both,
Sure.
in any part of medicine, I think.
Yeah, the insurance-based side,
Sure.
high volume.
Yep.
Great quality, but not maybe as good of a quality as we can deliver.
Yes.
Because we have more time.
Yeah.
We have more bandwidth.
Right. And I think we can develop relationships with our patients a little bit more. So we really get to know them. I mean, I consider a lot of my patients my friends.
Yep.
Hi, friends.
I have friends too. I just went to a Ferrari show, car show with one of my patients in St. Pete. So
that's fun. Yeah, that's a lot of fun.
You know who you are.
Yeah, exactly. So what are some things that you tend to focus on? Are there any particular diagnoses, or do you just kind of see the full gamut of things?
In the ER, I would see a lot of sick people, right? A lot of patients who were told that they had a normal heart from a normal stress test, and they'd come in a week or two later with a heart attack. And I'd say to myself, something's wrong with that. Why are we not catching these heart attacks sooner? How could we prevent these? And so some of these antiquated tests, stress tests, and they miss 20% of patients who have real cardiovascular disease. So I do focus on heart disease quite a bit, even though I'm not a cardiologist. The reason for that is because heart disease is the #1 killer in the United States. The big reason for that is because of our diets, our American diets,
Absolutely.
Right? So there's a lot that I talk about with my patients. Hey, this American diet that we've learned since we were kids is the wrong diet, and it's unfortunate because so many of us grew up that way, and so you learn a lot as you go through. Not so much in medical school. I did not learn about nutrition in medical school. There was just too much to learn. Maybe we had one lecture out of thousands and thousands of lectures on nutrition. I had 0 test questions on nutrition.
Yeah, we didn't have any.
Yeah. And so, sleep, proper eating, exercise, proper physical therapy after an injury. These are things that, can help you live longer, safer, healthier, stronger, right?
Yeah. So there's a nice emphasis on wellness. So I can say that I do the same. A lot of times it's not just, okay, we're recovering from an injury, we're preventing the injury from happening, whether it's proper ergonomics when you're sitting at a desk. Is it body mechanics? Are you squatting and trying not to twist or bend to do things? It could be, I have tight muscles, and a lot of my patients, they just come in and they have very tight muscles, and it's preventing them from doing anything. They can't sleep. They can't work. It's just everything becomes, it's almost like the energy gets sucked out of them.
Sure.
Because when you're in chronic pain, that's what happens, right? You don't have the energy to do your daily activities. So a lot of times I'm just working on them, trying to prevent things from happening in the future. I have some patients that come in maybe once a month just for a wellness visit. And so they come in and they say, well, my neck hurts. I'm like, okay, let's work on your neck. Let's take a look at that. my back hurts, my foot hurts, it could be anything.
And you charge like a monthly membership for this, or?
I charge a per visit.
Per visit?
Yeah, per visit, which comes out to be, whatever they want. So yes.
Nice.
And typically what I'll do is I'll bring them in for the evaluation. Some people they start with wellness and they end with wellness. They just continue on. Or they might start with an injury and then it depends on what the injury is. Sometimes it's like, well, okay, you're discharged, But really, I developed a relationship with the patients so they'll come back if they ever need me. And then some of them, they will continue on to a wellness program because it's keeping them well. Because otherwise, how many times have you gone through physical therapy or gone to the doctor and you're like, yeah, I feel great. But then 3 months down the road, the symptoms start coming back again.
Yeah.
Because you're not maintaining it somehow.
Right. A maintenance program is important.
Yeah.
I'll tell you what, I was a patient. I was a real patient, in a physical therapy clinic. And, I couldn't walk for about 5 months after my surgeries, like 2.5 months on both sides. And so that physical therapy really helped me get back to living life again. Yeah. And it was a tough time, and you really help people in some of their most vulnerable states,
Yeah. And as we were kind of talking a little earlier, people just figure they're going to live with it. I'm just going to live with the pain. It's not going to go away. Or people have told them, you're getting older. It's probably arthritis, but it might not be. It might be something else. Maybe they need something with their joint mobilization or something like that.
And while we do focus on kind of general primary care, concierge medicine here, we are looking into now, and we do GLP-1s and some HRT work, but we're looking to partner now with somebody who is very good in the peptide world, right? HRT as well. But the peptides really have an interesting ability to heal quicker, right? And decrease chronic pain. So pharmacologics aren't always the way. Peptides, we have a lot of natural peptides in our body. And I think that's a very interesting area of medicine and research that I think is going to become, widely used, and we're going to incorporate it into our practice here maybe in the next couple of weeks.
No, that's great. And it's more conservative than other measures, I would
Sure.
imagine. Yes. Okay.
Sure.
Is that usually taken orally? Is it
some are oral? So a good bit are injections.
Okay, injections. Yeah, that's great.
Yeah.
Okay, so what do you hope to what's the biggest message you want to get out to people besides wellness? And and it sounds like you're doing great work and you have a passion for what you do.
It's a great way to practice medicine, and I would imagine you'd say the same. It's a great way to practice physical therapy in your own clinic, on your own time. Giving people kind of their time to tell us about their issues. I think the best message I would say is, if you're frustrated with your current doctor's office because they're just too busy, I'm sure they're a great doctor. It's just they're in a system that is very difficult to deal with nowadays with insurance. Come see us, Olympic Concierge Medicine. Come see Kathy.
Kickstart Physical Therapy.
There you go.
Yeah.
And I just think you'll probably get a more personalized approach from people like us, right?
Yes, yeah.
Compared to the larger systems.
Yeah. I feel a connection with people is very important.
Yeah.
So I like to connect with my patients and really you learn a lot more from them, and I think people heal better.
Oh yeah.
So we can spend the time with them.
And they can always call you and say, hey, Kathy, you did this physical therapy routine and I'm feeling a little pain here, but this feels a little better. Do you have any recommendations, right?
That's the benefit.
It's the same thing with us in concierge medicine.
Yes.
People text us, they call us, they email, and it's kind of a nice way. I mean, otherwise, in the big corporate system, right? You have to wait a month or two to ask your doctor or physical therapist that question. Oh, you have to get in for the office visit again. And it's just people, we live in the Amazon age. People want their packages at their doorstep today or tomorrow, and they want to talk with you or me today or tomorrow.
Yes, exactly.
So
the other thing is I just wanted to highlight, a lot of times people come in to see me and they might have a problem with their neck, their back, and their foot, right? So in the traditional medicine model, well, let's work on your back. And then when we're done with that, we'll start working on your neck. And then when we're done with that, we'll look at your foot. And I'm like, no, I'm going to look at everything.
Yeah.
I'll even look at your finger.
Right.
You know,
it's kind of like, well, if somebody comes into the ER or in my office, hey doc, I stabbed myself here with a knife while I was cutting a branch down, and I poked myself here with a thorn. Well, got to deal with both at the same time because they're both bleeding.
And then I fell down.
Yeah, I have a fractured leg or
something.
Right.
Yes. Yes. Yeah. Exactly. Okay. Well, it was really good talking with you.
You too. Yeah.
And anything else you wanted to mention? And what's your favorite quote? Do you have
an ounce of prevention is worth a pound of cure?
Oh, that's amazing.
Do you know who said that?
I think it was someone British, wasn't it?
Benjamin Franklin.
Oh, was it? Okay.
Yeah.
Well, he was British.
He was British.
Yes.
That's right.
Benjamin
and he lived
Franklin.
in Philadelphia.
Very nice.
Yeah.
Yeah.
So
Philadelphia, it's like, that's the start of America.
That's right.
Over there. Wonderful.
That's right. So.
Excellent. Okay. Well, thank you for meeting with me, and listen, everybody out there, come and see us. I think you're gonna be happy. So
take care.
Okay.
Hope to see you soon.
Yep. Bye.
Bye-bye.